Hello, my name is Maya Petrova. I am a medical consultant of Neurosoft company, and today we will perform acoustic reflexometry. In particular, we will perform acoustic reflex on the IPSI and contra sides and the acoustic reflex decay after that using audio smart device. These acquisitions allows to evaluate the functional state of different neural structures which are formed the acoustic reflex chain: cochlea, auditory nerve, cochlear nuclei, brainstem, facial nerve nuclei, and facial nerve on the IPSI and contra sides. Specific changes of the acoustic reflexes thresholds observed in the different pathologies, for example, conductive or neurosensorial hearing loss with recruitment or no, or for example, different pathologies of the brainstem or facial nerve. Acoustic reflex is unconditional defend reflex, and it's registered on the highly enough intensities of sound. So we need to instruct our patient in a proper way. Also, we need to perform otoscopy and ask our patient about different conditions which can be contraindicated. For example, the cases of hyperacusis. Before acoustic reflex registration, we have performed tympanometry in our patient, so we know the peak pressure, and this value will be automatically used by device in the acoustic reflex registration. If you have a new patient, you should firstly perform tympanometry. How can you do it? You can watch in the previous video. Before the start working with the device, we need to perform daily calibration using such type of test cavity with a volume of 2 milliliters or integrated cavity in the holder. To calibrate the acoustic reflex coefficients, we will use the big size cavity. To perform the daily calibration, we need to go to the Setup menu, System Preferences, Timp Daily Calibration. We position the probe in a test cavity and press Start button. We see the measured volume and the calibration process on the different frequencies. Okay, when you need to perform the calibration of the acoustic reflex coefficients, you need to position the probe in a test cavity of big size and press OK. We need to choose the proper size and fit of the probe tip and put it tightly on the probe. For comfortable working, we need to place the special shoulder harness on the patient and position the impedance unit here. After that, we need to put the probe tip with the rotating moves deeply enough. When we need to register contralateral acoustic reflex, we should use contralateral headphone. We connect it to a special socket in the plus timp block and position on the patient. Now we are ready to register an acoustic reflex. We need to choose the side, and the test will start automatically. We see the seal control process, and now the IPSI stimulation is gone. So they see that the compliance of the sound conduction system of the middle ear reduced with the increasing of intensity of stimuli, and then it reached the threshold that is put in the template. We can see here, yes, it reached the threshold, and the device automatically registers this intensity as the threshold for the acoustic reflex. Now they see that the IPSI trials is finished, and if we need a new trial, we can put here on the plus button and choose the necessary parameters. For example, I want to register the contra reflex on the 1000 Hertz and put here, and the trial will start. You see the stimulation is performed using the contra headphone. And normally the threshold on the contra side is almost the same, or in mostly cases a little bit higher than on the IPSI side. We can go to another trial if we want using the plus button, or also we can manage the list of the attempts in the template. How can you make your own template? I will show you at the end of this video. After that, we can save the results or even print if you have a Bluetooth printer, or save and export to the PC. Now we have finished an acoustic reflex thresholds estimation, and now we are ready to go to an acoustic reflex decay procedure. It allows us to evaluate the functional state of retrocochlear portion of auditory system, and during this procedure will be the loud intensity sound, which will be given using the probe or contralateral headphone in some cases. So we need to instruct about it our patient, and we ask the patient to stay still, not to swallow and not to breathe very deeply during this time. Now we are ready to perform the decay of acoustic reflex. Choose the site and see the list of parameters. To see the pressure at the peak, the intensity of the stimulus, as we knew the threshold on the 1000 Hertz here in this patient is 80 dB, so we need to put the intensity in the decay 10 dB above the threshold, so 19 dB is optimal. And the duration of the stimuli is 10 seconds. It's okay. We start the process, and the sound will switch on to the 10 seconds, and to see the compliance reduced because the stapedius muscle is constructed during the sound. Then the sound switch off, the compliance going to the baseline, and they see that the percent of the reducing or the compliance during the stimulation, 10-second stimulation, is here in this patient only 11%. This is a normal value. The normal value is till the 50%, and in cases then the decay percent is above than 50%. It tells us about non-oncological pathologies of the retrocochlear, a part of auditory system. And if in your patient decay is more than 90%, it is very suspicious to the oncopathology, for example, vestibular schwannoma. Now I will show you how can we set up the test templates. We see the test settings. After that, we need to choose the necessary procedure. A few words about how can we manage the process of simultaneously registration of tympanogram and acoustic reflex. Go here to the tympanogram. You see that the current template is timp standalone, but also we can choose tympanogram and after that acoustic reflex registration. In such cases, please put the dot here and then you will register a tympanogram. After that, automatically the system will go to the acoustic reflex registration. In such cases, then you want to set up also acoustic reflex by itself template. Go here and you see one default template, but you can't change anything, any parameters here. If you want to change some parameters, you need to create the new template, name it, and after that you see that you can change, for example, the mode of viewing. Also you can change the sensitivity threshold, the step of increasing the intensity step by step, and so on. Also you can edit sequences list, as I have said before. So maybe you want to register IPSI and contra by default, so you need to choose what frequencies do you want to register. Also you can use not only pure tones, but also, for example, white noise. You can choose it if you want. After you finished, you go to the main menu, and after that all the registration will be made according to the parameters using in your own template. Today we have watched with you how to perform acoustic reflex threshold estimation and the acoustic reflex decay test. I hope that this video was useful for you. Thank you for your attention.